Dear colleagues, I'm Christoph Diener, Senior Professor of Clinical Neurosciences at the University Hospital in Essen in Germany. Today I have two very exciting new studies. One is about patent foramen ovale in cryptogenic stroke, and the other one is about proton pump inhibitors and dementia. Let me start with PFO. We had a number of observational studies which indicated that in people who have a large PFO and are younger than 60 years and had a cryptogenic stroke, perhaps PFO closure could prevent recurrent strokes. But the two studies that were done were unfortunately underpowered and only showed a trend towards efficacy of PFO closure. Now, on September 14th, the New England Journal published online 3 studies which were finished at the same time, and they interestingly have an identical result. The first trial was coordinated out of France, the GLOW study. The GLOW study recruited 663 patients who had a large PFO or an atrial septum aneurysm and a cryptogenic stroke, and these were randomized to either PFO closure, antiplatelet therapy, or anticoagulation. The primary endpoint was stroke, and the follow-up was 5.3 years. In the closure group, there were no strokes among 238 patients, and in the antiplatelet group, there were 14 strokes in 235 patients. The hazard ratio is 0.03. By the way, there was no difference between all anticoagulation and antiplatelet therapy. The REDUCE study, which was coordinated out of the US, randomized patients with cryptogenic stroke and a medium or large patent foramen ovale in a ratio of 2:1 to PFO closure or antiplatelet therapy. They also performed brain imaging at baseline and after 2 years. The primary endpoint was freedom from ischemic stroke and freedom from the recurrent strokes on imaging. So the study recruited 664 patients. The follow-up was 3.2 years on average. The rate of ischemic stroke was 1.4% in the PFO closure group compared with 5.4% in the antiplatelet group. This was a hazard ratio of 0.23, and new brain infarcts, both silent and apparent, was 5.7% versus 11.3% in favor of PFO closure. This translates into a relative risk of 0.51. The third study was the RESPECT study, which compared PFO closure or antiplatelet therapy in patients with large PFOs aged between 18 and 60 years. The endpoint was a composite of fatal or non-fatal ischemic stroke and early death. There were 900 patients in the study, and the follow-up was almost 6 years. There were 18 events out of 499 patients in the PFO group and 28 out of 481 patients in the antiplatelet group. This translates into a hazard ratio of 0.55. So, ladies and gentlemen, very convincing data from 3 independently performed randomized trials. PFO in patients below the age of 6, PFO closure in patients below the age of 60 is highly efficient and is clearly superior to antiplatelet therapy. The procedure has a few side effects and risks. So, for example, de novo atrial fibrillation was observed in between 1 to 5% of patients, and in some patients there was a problem with the device. I think these results would definitely change our guidelines. Now, the other topic is the relationship of the intake of proton pump inhibitors with dementia. In 2016, JAMA Neurology published an analysis from Germany. This was based on insurance data, and they looked at 73,679 patients above the age of 60, and 2,950 of those took proton pump inhibitors. And they looked at the diagnosis of dementia in the database. They found a hazard ratio of 1.44, which would indicate that proton pump inhibitors increase the risk of dementia. And unfortunately, the authors really recommended to avoid PPIs in this patient group. Now, I think no one of us believed the data for several reasons. The sample size was small, and the authors unfortunately did not correct for confounders. Now, in this week, two papers came out, one in gastroenterology and the other one in the American Journal of Gastroenterology. The first study was analysis of the nurses' health study. This is a prospective study, and the analysis is based on almost 14,000 nurses, which were prospectively followed, and they had a neuropsychological test battery. Now, over time, there was no association of the intake of proton pump inhibitors and cognitive function. The other study from Norway is even more convincing. They identified more than 70,000 patients with dementia and compared them with 282,000 controls. The odds ratio for dementia with the intake of proton pump inhibitors with a time lag of 3 years was 1.03 and clearly not significant. Also, if they looked at longer time intervals, they couldn't find a relationship between the intake of proton pump inhibitors and dementia. Why is this important? The study, which was published in Journal of Neurology, caused a lot of problems in the public press. This came out basically as kind of evidence that proton pump inhibitors lead to dementia, and unfortunately, many patients who definitely need these drugs stopped the intake. And I think this shows again that we should be extremely careful to draw conclusions about therapy of patients from underpowered observational studies. Ladies and gentlemen, two exciting developments this month in September. One is closure of PFO is highly effective in patients with cryptogenic stroke, and proton pump inhibitors most likely do not lead to dementia. Thank you very much. I am Christoph Diener, Senior Professor of Clinical Neurosciences from